The fantastic thing about a knowledge exchange is the fact that we really use this as an opportunity to share the kind of learning that we gain from our participants and for the participants of our programmes to actually share with each other. You learn so much doing the sort of formal theory, but actually applying it in real life is where that sort of nitty-gritty learning comes out of. And people want to hear the dramas, the successes, the failures of what's actually happened to them, because then actually they can replicate some of the successes and they can learn to do things differently out of the things that haven't gone so well. So people like that real narrative, that storytelling, those case studies, what we've been. And what's fantastic about today is we've combined several of our programmes. So we've got large-scale change, small-scale change, we've got service improvement, we've got transformational change, and all of those feed into each other. So that's really fantastic. There's quite a buzz in the room today.
One of the things that I've really liked about today were the posters. So this group of people have been on 2 different programmes, which really only started, some in the summer, some much later, and yet they've produced posters which cover the work that they've been doing locally, and I'm really impressed with what they've managed to achieve and how they've used their new learning and been able to present it in such a way that demonstrates that they've understood and they're actually using it to really help them deal with some tricky challenges back in the hospital or the organisation they work in.
The real highlights of the day for me are when we ask some of our participants who are not experienced public speakers to be bold enough to come onto a stage to speak to a very large number of people and to actually share their journey. And that's a new experience for them, and we get an insight into what their world has been like and the excitement and some of the lows about their journey. And actually that really grounds our programmes in the reality of delivering improvement and successful change in the NHS.